if everyone here was in the other meeting, but yeah, maybe we can continue from where we left.
Yeah, we should continue from where we left because the meeting was good, but we apologize for all these hacksters in the world. There are too many. So when we are on the World Wide Web, we also are going to attract people with serious mental health disorders who try to hack into other people's work. These are people who are trying to spite Zoom. So it's not about us, it's about them trying to spite Zoom, saying, okay, Zoom, you have made all this good communication system. Look what we can do. But I think if the link is not shared too widely, then we are right, because most people want good things to happen. There are few people who are hacksters over there. They don't want to hear about mental health, I imagine. Okay, Brenda, back to you. Thank you.
Okay, so can you guys hear me?
Yes.
Yes, we can hear you.
Okay, so I think I'll try to be a bit fast because I think it's almost 8:45, but just to repeat, so the top 10 causes of work stress. So we listed some of them as long working hours, low job control, work-family conflict, shift work, job demands, job insecurity, organizational injustice, low support, low rewards and benefits, and employment. There are many more reasons or causes of work-related stress, but these are some of the commonest ones. I'm trying to move to the next slide. Not sure why it is. Not sure why my slides are not moving at the moment. Okay, that's fine. So I think we also went through this. So some of the signs that your employee may be struggling as an employer include difficulty in productivity, disengagement and isolation, decrease in the quality of work, changes in mood, making snap decisions or impulsivity, sudden increases in day offs or sick offs, higher sensitivity to feedback, and visible signs of exhaustion. So the commonest cause or the commonest symptom that an employee will present with that would lead trigger a possible diagnosis of work-related stress would be behavioral change. So I think this is where we left it at. So some of the commonest impacts of mental health issues at work include absenteeism, where employees who are dealing with mental health issues are more likely to take time off work. Then the opposite is what is known as presenteeism, where a person is physically present at work, but in as much as they're in their workplace, they're not reaching their full potential. Then these are the employees who will make errors or accidents. So these mental health problems can lead to accidents due to stress, anxiety, or a lack of concentration, and their productivity will actually go down. So employees who are struggling with their mental health will have reduced productivity at work. So what's the relationship between stress and mental illness? So usually, if acute stress is not dealt with or managed, it will lead to chronic stress, and chronic stress is what will lead to mental illness if undiagnosed and untreated. So stress causes the body to release a hormone, which is called cortisol. So cortisol is one of the major stress hormones, which is important in blood pressure regulation and the normal functioning of other several body systems, including the cardiovascular system, the circulatory system, and reproductive health. So stress hormones affect areas of the brain, key to memory and regulating emotions as well. That's why people who have mental health problems will have forgetfulness and will also be moody. So chronic stress and prolonged activation of the immune system could negatively affect how our brain works. So what are the consequences of mental health problems? So mental health has profound effects on an individual because an individual will make up a family and the families will actually make up societies. So mental health being a problem will affect either a person, families and their caregivers, and the society at large. So the single most important factor in the treatment of psychological disability or mental health problems is early intervention. So what is the importance of promoting mental well-being in the workplace? So the first importance is that it enhances employee well-being and satisfaction, where employees who feel supported are more likely to experience job satisfaction, which leads to better overall well-being. It also improves the productivity and performance. So when employees are mentally healthy, they are more engaged, they are more focused and productive, and they perform better. It builds a positive organizational structure where employees are more likely to speak up about their needs, concerns, and ideas, which contributes to a healthier organizational culture. So it also reduces stigma around mental health because a supportive environment will actually normalize conversations on mental health, and this encourages help seeking amongst employees. So long-term organizational success as well. A supportive environment helps retain institutional knowledge and promotes a culture of continuous improvement. And it also helps with crisis management and resilience, where resilient employees are better equipped to handle challenges and to adapt to change, ensuring the organization remains stable and capable of overcoming obstacles. Some of the ways in which employers can promote mental health in the workplace includes implementing mental health policies and practices, developing and implementing clear policies, and prioritizing mental health as well. And this includes regular assessments and audits of the workplace mental health, such as surveys, just to find out what the general mental health status of the employees is. Then providing access to mental health resources. So employers can actually offer employee assistance programs for employee support, and it can also provide training and awareness on mental health. Then employers can also encourage work-life balance, where they can offer flexible working arrangements such as leaves and remote working, and employers can also avoid or limit excessive overtime. So there's something called the Framework for Workplace Mental Health, which essentially offers a foundation that workplaces can build upon. So there are different components. So the first one is called protection from harm, where employers protect employees from toxic workplaces, as well as normalizing and supporting mental health. And the needs supported include safety and security. In regards to connection and community, employers create workplaces with opportunities for social connection and community, and they create a culture of inclusion and foster collaboration. And here, the needs supported include social support and a sense of belonging. Regards to work-life harmony, employers provide autonomy over how and when work is done, as well as respecting employee boundaries. And the needs supported here include autonomy and flexibility. So when employees feel that they matter at work, it is when employers create a culture of recognition, connect individual work with the organizational mission, engage workers in workplace decisions, and provide a fair living wage. And this, the needs supported here include employee dignity and a sense of meaningfulness. Then if there is opportunity for growth, it is when employers offer training and mentoring opportunities, creating clear, equitable pathways for career advancement, and provide useful and biased feedback. And the needs supported are actually learning and accomplishment. So as an individual, there are different types of self-care that you can actually do or participate in that can actually promote your mental well-being. So this includes physical aspects such as sleep, exercising, physical release, eating healthy, meditation, exercises such as yoga and rest. Rest is actually a very important component of mental health. Emotional things such as being able to manage stressors by getting better coping mechanisms, emotional maturity, forgiveness, compassion, and kindness. So social activities include trying to set boundaries, support system, watching positive things on social media, practicing adequate communication skills, spending time with your family, friends, or your loved ones, and actually asking for help when you feel like you have a problem or a stressor that needs to be followed up. There are people who, for the spiritual people, you can actually take time alone, meditation, yoga, getting connections with your religious, what you believe in generally, being one with nature, going for walks, journaling, getting your own space. This actually falls under meditation. So in terms of personal self-care, you can actually do what you like doing, your hobbies, striving to know yourself better in terms of personal identity. Then in terms of finances, you can actually start saving better, budgeting, money management, and paying bills. So when it comes to work, in regards to self-care, you can actually manage your time well. So if your shift is an 8 to 5 shift, by 5, you just make sure that you've already left work. Establishing work boundaries, positive workplace, more learning, and break time. So taking adequate breaks, taking lunch breaks, and the like. So self-care is actually not selfish. So when are you supposed to seek professional help as an individual? So when you start having persistent feelings of sadness or anxiety, when you feel like you're unable to cope with daily life stressors, when you're finding it difficult to manage relationships, when you've actually gone through traumatic experiences such as loss, abuse, or assaults, and you're unable to cope, behavioral issues or self-destructive behavior, and if you have a desire for self-improvement or personal growth. So I think in Kenya, we're actually at a good place in terms of mental health because the government, more specifically the Ministry of Health, came up with national guidelines on workplace mental wellness. And the first edition actually came out in 2023, that's last year. So I'll just mention a few key points that I saw might be important. So for example, it actually gave employers and employees tips on how to set up a successful mental wellness program. So it's outlined how to do this in 6 steps. So the first one would be obtaining leadership support and commitment, appointing a workplace mental wellness committee, developing a workplace mental wellness policy, developing a work plan and mobilizing resources, operationalizing the workplace mental wellness program, and undertaking continuous monitoring, evaluation, and improvement to see where you can better improve your mental wellness programs. So it's not a one size of shoe fits all, but you can see what works for your company or your organization. So it also highlighted strategic approaches to a healthy work environment, and it divided this into 3 steps, which I'll actually just highlight. So there is promotion of mental wellness, there is prevention of mental health conditions, and there is support and care for those who are already affected by mental health conditions. So in terms of promotive strategies, these are initiatives that help workers to increase control over and to improve their mental health. So as an individual, what would be your role in an organizational setup or as an employee? So you can actually participate in self-care activities, engagement in hobbies, setting boundaries between work and social life, setting realistic goals so that you're not always feeling like you're under pressure, then championing mental wellness at work and at the community. So what can managers and supervisors do to promote mental wellness in the workplace? So they can give employees opportunities to participate in decision-making. They can actually come up with flexible schedules. You can work from home if you're unable to come from work, or when you have young children who you're nursing. Providing resources and information on mental health services available, and team building activities that promote social connections. Then as an organization, you can actually end up developing workplace guidelines for health and safety, providing conducive and supportive physical working environments, providing employees, supervisors, and managers with mental health education and training, then offering incentives to reinforce healthy behaviors. So in regards to preventive strategies, which are basically interventions aimed at minimizing the burden of mental health problems and associated risk factors, As an individual, you can actually participate in this by building coping strategies for difficult circumstances, such as managing your anger, good conflict resolution, seeking help if you feel like you need help, asking for help from supportive colleagues, adopting stress management techniques such as meditation, and participating in employee-sponsored wellness programs. So there are many other things you can do, but these are some of the things that you can actually do. So managers can also identify those at risk of mental health conditions and link them for support and care. They can define clear and achievable goals for teams or individuals. They can do regular audits for job descriptions and ensure that the workload is well distributed so that one person doesn't feel overwhelmed. They can come up with realistic and flexible guidelines with regular one-on-one check-ins with employees, and they can actually provide constructive feedback on performance with recognition of employee efforts and achievements. Then as an organization, the organization can actually provide resources for training on coping skills. Sorry, I think I've gone back, sorry. They can hire adequate staff to minimize burnout or chronic fatigue. They can approve flexible working hours. They can facilitate assessment of working environments and provide solutions to problems that arise. And they can actually provide stress management interventions and material that employees and managers can go through. Then in terms of support and care strategies, so these are basically interventions for workers to receive treatment or management for recovery from mental health problems. So as an individual or an employee, you can actually utilize the employee assistance programs. Then you can share personal experiences with others to help reduce stigma where appropriate, seeking help when you are in need, communicating with employers when needed to be off duty to attend to hospital appointments, responding with empathy, and offering peer support and encouragement to others who seek help, and not participating in stigmatizing activities. Then managers can actually provide time for employees to attend medical appointments, supporting employees on their return and integration to work after treatment, inclusion of employees, those dealing with mental illnesses or psychosocial disabilities, support groups that allow employees to discuss mental health, listening and showing empathy to employees, identifying and supporting mental health champions in the workplace, and supporting employees to have reasonable working hours. Then as an organization, establishment of employee mental wellness programs, providing non-discriminating work environments, offering health insurance for mental health services, ensuring that mental health is accessible at the workplace through referrals, facilitating clinical screenings for mental health programs, payment or compensation when one is on sick leave, and supporting employment of people with mental health conditions. So I have rushed through the presentation because of time, but just remember that there is no health without mental health. Thank you.
Thank you.
Thank you so much, Dr. Brenda. That was an amazing presentation. And I'm glad we are doing this because mental health is very important. And I like that you said that self-care is not selfish. And throughout your presentation, you have shown us different things. Number one, you started with showing us how mental health is very key and very important for us to address because it is ranked the fifth in the non-communicable diseases. You have also mentioned that many mental health issues goes undetected, which is also something very important because you have also said that the key to addressing mental health issues is early detection and yes. So you have also given us ways to cope with mental health issues at workplaces. And thank you so much for that presentation. I would like now to welcome Dr. Macharia for additional comments. And if at all you have any question, you can put it in the comment section, or so that we can address it in the Q&A session. Dr. Macharia, you're welcome.
Oh, thank you, Susan. Thank you. Am I audible, Susan?
Yes, you are, Doc.
All right. Wow. Thank you so much, Brenda. I'm telling you, mental health is serious business. When you say that mental health is the fifth of the communicable diseases, but I would hazard to say that mental health is the leading non-communicable disease. I think the prevalence of mental health is far greater. Mental health disorders is far greater than cardiovascular illnesses. I would say that. I don't know. Because remember, those cardiovascular illnesses, many of them are related to aging, but mental health begins very early in life. Mental health problems begins early in life during the teenage years. So, Dr. Brenda, you said about 20% of 20% of us, like one in every five people, have a mental health, condition. That would say that's about one every five people. Did I get that right?
Yes, you're very correct.
That's 20%. Ladies and gentlemen, 20% is a lot of people. It's a lot of us. Okay. And that's very high prevalence, but that's far greater than cardiovascular illness, I would imagine. And the other thing is very high, widely distributed because it begins very early in life, like in the early adulthood, even perhaps even teenage life. So it's a very big issue, and I believe that here at Actuate Nation, we want to let's say to uplift the knowledge about mental health to the top, because without mental health, then what do you have? So I have a question for you now in workplace. Now the work environment is changing. It's a very dynamic situation right now, where with all these technologies, you find people working remotely. And I think that many companies are still having traditional workplaces where people go in the morning, 8 to 5 jobs, they report at 8 and then they leave at 5. But maybe in the next few years, say over the next decades, you're going to see a lot of remote work environments. People working, say for example, the way we do it at Actuate Nation, where you don't have a physical building office, but people are working virtually. Now, a lot of things you've told us relate to physical work environment. But do you think that mental health will also have, maybe, is it much easier for people to work virtually or remotely? Or have you seen any differences where people are working virtually, remotely, as compared to people who have to go to a physical office to work in person?
So I actually think my presentation was actually, so long as you have work, whether you work physically or you work remotely, you're at an increased risk of getting mental health conditions, because in as much as you work from home, you have the risk of still having increased job demands. There's still job insecurity. They could still be long working hours. You could also not be still having support from your employer. You could also get laid off. The rewards and benefits might also not be the same. So I feel like the risks that you would get working physically more or less are the same risks that you'd get with working remotely. So it applies to all people who are in a workplace, whether remotely or physically.
Excellent. Or perhaps even people working remotely, the stress gets multiplied because you don't have that social support. You don't have your workmate. You don't even have someone unless you call them on the phone or you text them. You cannot even see the people. So there could be some social isolation that are much more likely. That's people being isolated is much more likely. And then people overworking, because when you're at home, you can get up and start working in a minute, and without break, you don't even know how to break. So it is self-directed place of work. But in a physical office, at least you're together, lunchtime is lunchtime. And when you see other people going for lunch at the canteen, or they go downstairs for food. But when you're at home, you are alone. So this, what you said about, when the time finishes at 5 p.m., you go home. But if you're at home, you don't go home. What do? You turn off your laptop and your machine, and you say, okay, my work day is finished. So that's the whole thing. So I think it's this work environment changing, particularly remote work. I think remote work could become even more stressful.
Yeah.
Because of that social isolation. And then the remote work environment does not respect time. For example, if you're working in different time zones, like now I'm here in Boston, it's right here, it's in the afternoon, 2 p.m. But then over there, it's already night, 9 p.m. See that? So that if you're in an office that's now disparate like that, for example, when you're working together, I get woken up at midnight or 2 a.m. by people calling me, they're calling me from East Africa, not knowing, okay, well, 2 p.m. in East Africa is what? There's 2 p.m. in East Africa is 7 a.m. here. Or let's say, so when somebody wakes up in the morning in Nairobi, then gets to work at 9 a.m., calls me, that is 2 a.m. here. See? So the remote work environment now creates new forms of stress, particularly in time management. And so I think in such situations, is what you want to understand is how, when you say leave work at 5 p.m., leave work at 5 p.m. So even if people call you at 2 a.m., you would treat them the same way you would treat them as if they were coming to your office. They're not going to come to your office at 2 a.m. in the morning to wake you up. All right. So yeah, that's what I'm thinking about this new, and I think we need to do more studies to find the implications of these new work environments, like virtual workspaces, to mental health. So I have a question for you, Brenda. Assessment. You said that we need to look maybe continuous assessment at work. Maybe what kind of, how can we assess the mental health of the employees at the workplace?
So I think it actually depends. Gold standard would be to maybe have adequate referral systems to either a mental health practitioner who will be able to assess to see which kind of mental health condition someone has in the workplace, because it could be anything from substance use to anxiety to depression. Of course, sometimes that is not, it can't be always done in a workplace setup, but what employees or organizations can do is to have adequate referral systems. For example, if an organization has insurance, they can say our employees go to a certain hospital for their mental health needs. So such things. Because sometimes we do not expect for people to make the fellow employees or a mental health committee to be able to make diagnoses at work. Because that employee needs to be adequately examined. They might need to do a few questionnaires to see what exactly, what kind of help they need, be it psychological help or medical help. So referral systems would actually be better, and complicated referral systems, yeah.
And so for example, if you're having a whole bunch of employees and they would like to monitor their wellness, like their wellness or well-being, is there a certain instrument that you can use, like a questionnaire, you send them, and then you review them and say, okay, oops, because to diagnose any underlying issues that are happening, to detect them, so that, because a lot of these things, like if 20% of the people are having these issues, they are not going to tell you voluntarily, or they're not even aware of it. Is there certain instruments that already may be existing in the marketplace that we can use and apply, and you tell every 3 months you do self-assessment? Yeah. And
so in terms of employees. So first of all, we actually encourage more of preventive mental well-being as compared to, so promotive rather. So how can I explain it? Rather than, so yes, there are many self-administered questionnaires, which are very simple, but I feel like that's a whole topic altogether. Because there are very many self-administered questionnaires that can actually screen someone for anxiety or depression or substance use to assess the severity or how bad their health conditions are. But sometimes they can usually have a lot of bias. That's why it's actually better to fill it in a healthcare setup. Although, yes, there are some. I could actually maybe share a few if anyone is interested. I don't know how people might get them. I think it would be better to see how some of them look like. Yeah.
There's some organizations that use those personality questionnaires like Myers-Briggs on the Minnesota Multifaceted Personality Questionnaire. You know that one, MMP. Yes, a lot of companies do that, but they're not really for assessing mental health. They say they're assessing personality of the personality. Do they have any implication in mental health, or what is personality and the difference between personality and mental health disorder?
So personalities, there's very many personalities, but some of the commonest personalities that people usually mention are things such as narcissistic behavior or borderline personality disorders. Again, very wide or broad topic. So in as much as you assess someone to see how their personality is, most people never have personality changes. It's actually something that is innate. So rather than assessing or seeing how someone's or which kind of personality someone has, screening them for mental health disorders by doing depressive skills or anxiety skills or substance use skills, that is actually better, because personality skills, yes, you'll assess someone for their personality, but after that, there is no further intervention that is actually done. It's just to see if they are at an increased risk of getting mental health conditions or mental health disorders. But personalities usually, generally, they never change. It's something, your personality is something that you are actually born with.
Yeah. So what I think as employers we want to have is a test that we can use, like a mini mental health test.
Yes.
Yeah, that you can just say you can administer during. I think the way we can suggest this is that at employment you apply that mini mental health test, so that becomes the baseline, and then you can be doing it every 3 months or every 6 months to see whether there are changes. So that way we can actually detect any emergence of now the clinical illness for in this 20% of the population. Yeah. I don't know. I was just thinking about assessment, because that can help us capture the illness before it breaks out. Okay, maybe you can open this to questions. I'm sure there are many people with lots of questions, and also people would like to seek help. Yeah. So Susan, are there any questions in the?
So I can't see any questions in the chat box, but if you have any question, please you can raise your hand, and then we are going to give you an opportunity to ask the question.
Yeah, you see, we were disrupted by those hucksters. Yeah, because and so that I think people we lost a few people when we relocated. Okay. Well, this is a great conversation. I believe that we should continue and dive deep into mental health. But I'm glad to see that the Ministry of Health is taking very serious action, even having developed a policy on mental health in Kenyan Ministry of Health. All right, back to you, Susan.
Okay, thank you so much, Doc, for that. I can't see any questions. So I'm going to give this opportunity to Frida. so that she can give us closing remarks. But in case you have a question, you can still post it. So Frida.
Okay, thank you very much, Susan. And thank you, Dr. Ombane, for that session. From what I've taken away from this session is that mental health in the workplace is very essential. Just not only for the you as a personal you as a person, but also for the organization. Yeah, for an organization to be successful, we need to also consider the mental health of employees. Yeah, we have explored the causes of work stress, recognized the signs that employees might be struggling with mental health, and also reflected on how mental health issues impact productivity and satisfaction and also organizational health. So we've said that prioritizing mental health being is not just for healthy employees, but also for a more compassionate workplace culture. And organization needs to support people with mental health illnesses. Yeah, and also value employees. And also we've discussed the frameworks for workplace mental health and the importance of self-care. So you as a person, you need to take care of your mental health. Yeah, and I would encourage everyone to integrate the principles you've learned into our organizations, into our daily lives. Yeah, make sure that you create boundaries in your work and also social life. You cannot be there working 24/7. You also need to go out, socialize. At least I think it helps also with mental health, especially if you're working remotely. So lastly, I'd like to take a moment to mention that Dr. Ubane will also be coming to our Nairobi Summit. So we hope to see you there. And yeah, we'll have the workshop on mental health, and I think it will be a very insightful workshop. So don't miss out. And as we said, our summit will be happening from the 3rd to the 6th of December at Kenyatta University, and you're all welcome to join. So thank you very much, and have a lovely night.
Susan.
Okay, yeah. Thank you so much. Thank you so much, Frida, for the closing remarks. And thank you everyone for joining. I'm going to post the form for attendance form because we reward those people who joined these sessions with Actuate tokens. So make sure that you fill in the form, and then we are going to send you tokens at the end of the month. Okay, just give me a minute. Okay, so I have posted the form in the chat section. So make sure that you fill in the form before leaving. And thank you so much again, Dr. Brenda Umbane, for that insightful session. Thank you everyone for joining, and the meeting is adjourned.
Okay, awesome. Thank you.